time for two questions. One question from the audience in Zamboanga and one question from the audience here in Manila. Can we start from Zamboanga? And just one question from the audience. Alex, do you have any question from your audience?
Dr. Hasan, this is Maya. Dr. Surya, the urgent phone call. At the moment, the resident is still thinking of a question. Can we get a question along from your side?
Okay, do we have any question from our audience? From the students? Okay, Ferhan from a surgical resident here from PGH, Dr. Giselle Catalan.
I am Dr. Catalan from PGH. The points presented have several arguments, both backed up by researches and figures. I'd just like to ask, if it boils down to the practical point of view, how many institutions are capable of doing this breast conservation procedure, meaning that they have a full complement of trained pathologists and cobalt facilities? If we plan to give the best service to our public, we would only probably do this in a small minority of cases, since I think there are only a few institutions. But that's what I'd like to ask primarily is, how many places can we do this breast conserving procedures?
That's a comment.
Question.
Question to the other side. Zamboanga side? Okay, would you like to answer that from Zamboanga side?
Yes, Doctor, this is Maya. Since this afternoon the killer is just a debate, we would like to imagine that we have a trained type of pathologist and we have all the radiological facilities which are available to give such an option for a patient. But since we do not have, I think the purpose of this debate is to bring to the awareness of our the higher ups, I mean the directors of the hospitals, to perhaps look into this modality of treatment so that they may include it in their budget next year.
Thank you, Dr. Lim. Do you have any question from your side? Any question from Zamboanga side or comments?
I just like to ask a question regarding management after doing a modified radical mastectomy in cases of patient who have recurrence, total recurrence.
Professor Silvio, would you like to answer that?
Local recurrence would imply, as from our review, for early stage Breastca, meaning stage 1, there's practically zero local recurrence rate. This is the case we talked about. We are talking about early stage Breastca. But for advanced Breastca, I would imagine that indeed there would be a increased risk of local recurrence. Now, if you're talking about this local recurrence occurring in these advanced cases, we would also do wide local excision and post-operative therapy for these patients.
Thank you, Dr. Pastor Celia. Now, before I end this teleconference, is Dr. Celia back, Maya? Zamboanga, can you hear us?
I'm coming. Okay, we'll go ahead.
We're going to end this teleconference. Can you give us some closing remarks? Or is Dr. Bukoy around to do the closing remarks?
I'm sorry, Dr. Bukoy was a meeting with the regional director, so I just have to give a closing remark on our website here. Can I do that, please?
Go ahead, go ahead.
Before I give my closing remarks, can you give us a brief statement on who more or less made a good presentation or who was more convincing?
We'll throw that question to Dr. Liquete, who's the judge.
Well, in a debate like this, it's very difficult to have only one judge. But I do commend both sides for the good presentation that they've given. In terms of, when you're in a debate, you try to convince your audience by citing studies, convincing studies. And it seems to be that in this afternoon's debate, your side has given us more of these studies to back up your claim. So that's the most I can say. Sad to say, I really cannot give a judgment on this because I'm only one. It's going to be a very, very biased type of judging in the debate when you're only one who is evaluating the pros and the cons on the issues that were involved. But by and large, it's a very excellent exercise that you have this afternoon, especially for the residents.
Yeah, the other judge actually, which was scheduled to be invited here, was Dr. Laurico, but unfortunately he couldn't make it. As the moderator, I cannot say anything to be fair to everybody. But I think I must congratulate the two groups for presenting very well in this debate. Don't you think so? From the medical students' point of view?
Yes. Yes.
Okay. Now for your closing remarks, Alex.
Okay, thank you very much, Kay. I wasn't going to ask you also for your comment anyway. You are the moderator there, so we have to leave that as that. So on behalf of the Zamboanga City Medical Center, we would like to thank Dr. Osman, Dr. Liquete, the residents, staff, physical resident staff of the Philippine General Hospital, and medical students of the UP College of Medicine. Also the audience of the Zamboanga City Medical Center for this very fine and fruitful debate this afternoon. I hope in the near future we could have some more like this, and I think let's have some more in the coming months, and I think that's all.
As a way of ending this debate, let me say that all of us have heard the arguments for and against total mastectomy and subtotal mastectomy from both the PGH and the Zamboanga surgical residents. We also have heard the comments of our resource person. I'm confident by attending and participating in this debate, all of us have been stimulated to do some critical analysis of the issue involved, which in turn will help us make rational decisions for our future patients with the same problem in same situation. Before I finally close this teleconference, I'd like to thank the PGH and Zamboanga surgical residents, Dr. Alex Aurelio, Dr. Michael Liquete, and the audience from both Zamboanga City and here in Manila. I also would like to thank Dr. Arturo Pisigan, the coordinator of the telemedicine project of the UP College of Public Health, for making this teleconference possible. Thank you to everybody and good day.